So y'all, I did a Preservé augmentation this morning, and I wanted to show you the tools that we use for this type of tissue preserving breast augmentation. So with this type of augmentation, it is minimally invasive, tiny incision, and we start out with something called a channel separator. That's what this is right here. And this goes in to make a path for the next tool. And then the next tool is a balloon, and it's shaped in a very particular way in order to spread the tissue and make space for the implant. And we choose the balloon based off of the implant size. There's little markings on here. We put this guy in next, blow it up, and it creates a space by spreading and not cutting. After this step, the balloon is removed and the implant is placed. So it sounds really simple, but it is a bit complicated. Since we're not going through the crease and cutting tissue, we're precisely placing this balloon right where we want the implant. And because we're often using implants that are a little smaller than the diameter of the breast, and we want them in a particular place to give volume in a targeted location, it's really important you get that balloon in the right spot. It's also very important that you get the balloon in the right plane. So the balloon should be right above the muscle and not within the breast and not under the muscle. And it really takes some experience and knowledge of breast surgery to be able to do this. Now, I know there's been some people on social media saying that they do this without the Preservé tool, and I'm going to show you why they're wrong. So they do this with something called a saline sizer. So this is a sizer that we use in breast surgery. You can see it's an empty implant hooked up to a little tube, and you fill it with air to expand and make a space. So the same thing, right? No. So probably the most important difference is that this is a little firmer and affixed to this pole right here. So you can precisely place this and blow it up and it stays right where you want it, whereas this is flimsy and you obviously can't. The next thing is that the shape's a little different. Implants are flat and they have a gentle slope. This is shaped a little rounder, and the purpose is making a precise pocket for these Motiva implants, so you can place it where you want and have it be nested in the breast tissue, which is part of the tissue preservation, so you're not damaging the tissue as much. So using the saline sizer is sort of the same, but not as good. And so you certainly can do this, but making a space for the sizer, having it stay where you want when you inflate it, is just not possible without the right tools.